Howard Dean was at a healthcare town hall in Reston, Virginia, with Representative James Moran. After opening remarks by both of them, they did a Q&A with the audience.
Mr. E. Williams. E. Williams, Mr. Williams. And then actually whoever gets here first is the question. Alexandra Broadman. Mr. Williams or Miss Broadman? Are they coming? All right, why don't maybe we'll ask
Congressman, where is the Congressman, thank you for doing this.
Oh, good. That's Claire McIntyre up there in the stands who's also yes.
Congressman, my question is, do you think that a system involving co-ops is an acceptable compromise on health care reform?
Well, I personally don't, and I'll explain why. There's nothing wrong with healthcare cooperatives. In fact, many states allow them, and some states have them. But they're certainly not a substitute for a public option. Very difficult for enough people to get together to put it together themselves. For one thing, you need about 500,000 people to be competitive with the private insurance industry, and you need a lot of startup money. That's why it's felt that if the government was able to kickstart it with money that would be repaid, but so that it could eventually pay for itself. But the government has the expertise, having run Medicare, that it can do this. Healthcare cooperatives, frankly, don't. And so while I would encourage people who want them to go ahead and put them together, that's fine. The problem is there's no real profit incentive for anybody to invest a substantial amount of capital in setting it up, because they're not going to get repaid in the form of dividends or profit. So it's not comparable, but it's not a bad thing. Is this yes, Miss Esther Williams? Yes. Oh, E. Williams? Yeah. Okay. Go ahead. We need a microphone. Do we have a microphone then? We didn't know where you were. So where's Jessica? Or Claire? Claire, no, Claire has a microphone.
Yeah, I would like to know, are you and your family willing to go on the same house line? And also, have you ever, or any of your family members, lived on a so-called socialized medicine, as I call it? I have, and I've got relatives living on it. And trust me, it ain't working.
So as the crowd calms down, I'll respond. Yes and no. Of course I'm prepared. Actually, I live under I'm insured by the Federal Employees Health Benefits Plan. It's a full family plan, so I pay a very substantial amount every month, several thousands of dollars a year. I think it's over $6,000 a year I pay. But it's a good plan. I want to preserve it for all federal employees and retirees. Now, this is Alisa H. Alicia H. It looks like A-L-E-S-I-A-H. Is that you? Yes, sir. You want to get the microphone over there? Claire is coming with the microphone. This woman has been very animated, so she must have a good question.
Actually, it's the same exact question. Are you willing to take the plan? You do not answer it. Will you?
Well, the answer is yes. The answer is yes.
Ask and answer.
answered twice. Move on.
Is there Dennis Sawyer?
I'm right here.
Where?
I'm right here, sir.
Okay, and Claire, okay, good.
My question was actually answered when you were going through your myths and facts, but I've come up with a different one. What will the reform of Medicare Part D look like? I mean, right now we've got a situation where privatized health insurance is more in control of determining what kind of medications older patients can take. How is this going to change with this reform? What are we going to do about it?
Well, I will share with you my understanding of a deal, if you will, that was made at the White House with the pharmaceutical industry. In return for the pharmaceutical industry reducing that donut hole gap so that seniors would save, they suggest about $1,700 a year by being able to purchase drugs at less cost. In return for that, the government would not repeal that provision that prohibits the federal government from negotiating with pharmaceutical companies on behalf of Medicare beneficiaries in the same way that we negotiate with the Veterans Administration. I would not have made that deal personally, but I wasn't part of that. I wasn't there. I don't know all of the particulars. But in the Veterans Administration, sometimes you will pay a third to at least less than a half for most brand name drugs because they can negotiate. If we were able to negotiate using the Medicare beneficiary population, we could get the price of drugs down very substantially, but we're not allowed to do that, nor are we allowed to buy drugs from Canada. So, but at this point, the only thing that I'm aware of that would change is that the donut hole gap would be narrowed.